Felt very strongly that being a psychologist, I had a larger scope to help people and also to do more things to help people. The longer answer is I actually thought I was going to be a case manager. So my mother was a case manager at the community mental health center called MHMR here, and that's what I hung around. I'm a first generation student, so me and my brother are the first in our family to go to college. So I didn't think I could become a doctor until I joined the McNair Scholars Program. Dr. Gary Fireman, who was my mentor, said, "Well, is the thing you want to do, then if you're a PhD, you just have a larger scope. You have more tools, you have more experience, and you just have greater reach to help more people." Children and adolescents and populations affected by traumatic stress. My mentor, Dr. Fireman, asked me at some point when I finally decided I want to be a psychologist, well, what kind do you want to be? And I had no idea what kind there were, honestly. And so I was working for the Community Mental Health Center as an AmeriCorps worker, working adult inpatient and children and adolescents. And I realized all the people on adult inpatient had trauma, easily 90%. And so I told Dr. Fireman, well, I go to the adult inpatient, there's people with trauma there, then I go see my 10 and 9-year-old and they have trauma, so maybe start at 10 or 9 versus 39. And I said, I don't know if there's a doctor for that. And he said, well, that type of doctor is called a clinical child psychologist, which is what I majored in and focused in at the University of Kansas. Clinical child psychologist is, license-wise, we can work with any age range because the license is for clinical psychologist. No such license as a clinical child psychologist. But it would be similar to if you had a medical doctor who focused on pediatrics. If you're choking, they can help you. If you need amoxicillin and you're 45, they could help you with that technically, but their focus, what they spend a lot of time looking at, is pediatrics. So there's clinical psychology. Within that, there's a lot of subspecialties like health psychology, geropsychology for older individuals, family, and clinical child. And so clinical child psychology, to break that down, is we look at clinical things like depression, anxiety, PTSD, autism, focusing mainly on youth and families. So it's not that we only work with the kids. Actually, ironically, the biggest part of clinical child psychology is working with the caregiver. Things formally is that the training I have and the therapies I do are entirely evidence-based therapies, meaning that they have been tested by labs, by scientists, by researchers. They've been tested across the planet, literally. And so we have a lot of hard science showing that this works. Statistically, only 20% of providers are trained in that and implement that. So that's one of the things that sets me apart. A second thing that would set me apart is that I've studied with some of the top entities in the United States. So University of Oklahoma Health Sciences Center, University of Kansas. I'm affiliated with Duke University and previously finished up at Brown University as a faculty at their medical school. So I think that experience also sets me apart from a lot of psychologists. The experience of lived experience, meaning a lot of psychologists are really hesitant to talk about not just, if they have a history of trauma or mental illness, but if they have kids, if they're married, which never really fit with my style. So I've been told by a lot of clients that I'm more personable than other psychologists. The way they would actually say it is, you don't act like a doctor, you don't talk like a doctor, in a good way. That I specifically offer are evidence-based treatments, meaning treatments based in science, and specific treatments I offer are trauma-focused CBT, which is the premier, most validated research treatment for traumatic stress in kids 3 to 18. I also do a lot of work with adult populations with trauma, such as cognitive processing therapy, CPT, seeking safety. I also do work mainly with teens, dialectical behavior therapy. So I do a lot of therapy services, but I also do psychological assessments. And specific to my skill set, not every psychologist I'm trained to assess for autism spectrum disorders, as well as other things like learning disabilities such as dyslexia and intellectual disabilities. Something fun or interesting about myself is I own more comic books than any adult man ever should. Also, I have a dog named Buddy, who is very magical and very special. Buddy is very, very clever, but he doesn't like people because people can be dangerous and mean. But he's also very clever, and the people he does like, he's incredibly sweet too. published writer, not just published for my research that I've done with Auburn University, Oklahoma, but also published in terms of like a fiction writer. And also I received my black belt in martial arts the same year I received my bachelor's.